We've also seen the ability to have objective testing. A lot of our testing relies on a response from the patient, and as we all know, patients can struggle at times with some of the testing. All this requires is for them to sit there and look at a computer screen that's kind of moving back and forth, and it does not depend on a response from the patient. So the ability for it to be objective and provide us great functional data has been outstanding for our patients.
For a lot of the different disease states that we see within our practice, whether it's through the visual pathway, whether it's through the retina itself, having this objective data gives us more information to make our best diagnosis, make our best treatment plans, and how we can best care for our patients. I will do a pattern ERG. And what that does, it gives me information on the function of the retina itself. And this is something that I'm going to monitor over time because as I mentioned earlier, these are sick cells. And if we can treat that and get them functioning better, I can repeat the pattern ERG over the time. It's going to give me more information to see whether or not this patient is truly under control with their condition.
Well, one thing that's really nice about the Diopsys Nova system is that it's allowed us to really diagnose patients at a much earlier part of the phase, but also to sometimes really look at a patient differently than we had previously because we only had structural ways of monitoring that patient. So we have several cases where we've had patients that we started treatment much earlier. We've also had cases where we've actually stopped treatment on a patient because we're so confident in the repeatability of the Nova VEP, the visual evoked potential, as well as the electroretinogram, that we can monitor their position and decide to retreat or not treat.
It's not enough to just see if the structure looks better, because oftentimes the structure will improve, but there is no patient gain, meaning that it looks prettier, but the patient doesn't see any better, or the patient's seeing worse. With this test, you now have the ability to be able to say objectively, this treatment is seeing a functional event that's leading to better vision, or what I'm doing for this patient needs some adjunctive therapy because it's getting worse anyway.